Relapsing pancreatitis refers to recurrent episodes of inflammation of the pancreas, a gland responsible for producing digestive enzymes and hormones such as insulin. Each episode of pancreatitis can range from mild discomfort to severe, life threatening conditions, and it often results in significant damage to the pancreas over time. Causes of relapsing pancreatitis: 1. Gallstones and biliary tract disease. Gallstones can obstruct the pancreatic duct, leading to inflammation. 2. Alcohol use. Chronic alcohol consumption is a common cause of recurrent pancreatitis due to direct toxic effects on pancreatic cells. 3. Genetic factors. Genetic mutations, such as in the PRSS1, CFTR, or SPINK1 genes, can predispose individuals to recurrent episodes. 4. Idiopathic causes. In some cases, no identifiable cause is found despite thorough investigations. 5. Hyperlipidemia and hypercalcemia. Elevated levels of lipids or calcium in the blood can trigger episodes of pancreatitis. 6. Autoimmune pancreatitis. This rare form involves the immune system attacking the pancreas, leading to recurrent inflammation. 7. Pancreatic duct abnormalities. Anatomical issues such as pancreas divisum or ductal strictures can cause obstruction and inflammation. 8. Trauma or post-surgical complications. Physical injury or surgery near the pancreas can sometimes lead to recurring pancreatitis. Symptoms. The symptoms of relapsing pancreatitis are similar to those of acute pancreatitis and include abdominal pain, typically severe, persistent, and centered in the upper abdomen, often radiating to the back; nausea and vomiting; fever and chills; jaundice, if the bile duct is involved; weight loss due to malabsorption or fear of eating to avoid triggering symptoms; steatorrhea, fatty stools, a sign of exocrine pancreatic insufficiency. Repeated episodes can lead to complications such as 1. Chronic pancreatitis, ongoing inflammation resulting in permanent damage, fibrosis, and loss of pancreatic function. 2. Diabetes mellitus, damage to insulin-producing cells may lead to diabetes. 3. Exocrine pancreatic insufficiency. Impaired enzyme production leads to malabsorption and nutritional deficiencies. 4. Pancreatic pseudocysts, fluid-filled sacs that can become infected or rupture. 5. Pancreatic cancer. Long-term inflammation increases the risk of developing malignancy. Diagnosis: 1. Clinical history and physical examination, history of previous episodes, alcohol use, and family history. 2. Imaging studies: ultrasound to check for gallstones or ductal abnormalities, CT or MRI to assess structural damage and complications, endoscopic ultrasound EUS for detailed imaging of the pancreas and ducts. 3. Laboratory tests: elevated serum amylase and lipase levels during acute episodes, tests for hyperlipidemia, hypercalcemia, and autoimmune markers. 4. Genetic testing for individuals with a family history or unexplained recurrent episodes. Treatment. The management of relapsing pancreatitis depends on the underlying cause and severity. 1. Lifestyle modifications, abstinence from alcohol and smoking, low-fat diet to reduce strain on the pancreas. 2. Treatment of underlying conditions, removal of gallstones or treatment of biliary tract disease, management of hyperlipidemia or hypercalcemia. 3. Medications, pain management, NSAIDs, opioids, with caution to prevent dependence, enzyme supplements for cases with exocrine insufficiency, steroids for autoimmune pancreatitis. 4. Endoscopic and surgical interventions, ERCP, endoscopic retrograde cholangiopancreatography to relieve obstructions or remove stones, pancreatic surgery for cases involving strictures, cysts, or significant damage. 5. Monitoring and long-term care, regular follow-ups to monitor pancreatic function and manage complications, screening for pancreatic cancer in high-risk patients. Prognosis. The prognosis varies depending on the cause, frequency of episodes, and timely management. Early intervention and addressing the underlying cause significantly reduce the risk of complications. However, recurrent inflammation can lead to chronic pancreatitis and associated sequelae. If you have specific concerns or symptoms, consulting a gastroenterologist is essential.